Hello everybody. I think we're just going to get started and then other people can join us as they come. So hello and welcome to our webinar launching the fourth round of the Africa Grants Programme. So this year it's called the Africa Mother and Child Grants Programme. So you should be able to see our screen. All of you are on mute, so we're not able to hear you, but if you do have any problems or any questions, you can type them in the chat box, which you should be able to access through the top of your screen, and then we can respond to them as they come up. So the recording of this session, along with all of the slides, will be available after today on our website and on our YouTube channel, in case you do have any problems with connectivity or seeing the slides. We're planning on having some time for questions at the end, but in the meantime, if you would like to let us know about any problems, again, just use the chat box access through the top of the screen. So my name is Beatrice. I am a grants coordinator here at SET, and I'm joined by my colleague Will Townsend, who's also a grants coordinator. So I'll start with just a quick run through of the agenda today. We're going to start by giving a brief introduction to the objectives of the Africa Grants Programme and its scope, and then we'll look at very quickly just the history of the AGP, giving you an idea of the kind of projects that have been funded in the past. We'll then discuss eligibility criteria for the round and highlight some of the things that we're looking for in the application. Then we'll go through the application process and explain how to complete the application form and budget before looking at some of the next steps in the timeline for the projects once they've been successful applications. So hopefully there'll be plenty of time at the end of the session for questions. So it'd be great if while we're speaking you could jot down any thoughts that you've got, and then you can ask them at the end during the Q&A session.
Okay. So the Johnson & Johnson funded Africa Grants Programme supports the training of health workers in low and middle income countries within Africa. And projects they're seeking funding for should focus on essential surgery and anaesthesia for mothers and daughters. So the AGP is looking to engage partnerships between organisations in the UK and Ireland and their counterparts in Africa. This includes associations of medical cadres, societies, academic bodies, NHS foundation trusts, health delivery institutions, or NGOs working in global health. The aim of the partnerships should be to improve health services in low and middle income countries through the reciprocal exchange of skills, knowledge, and experience between partner organisations in the UK and Ireland and those overseas. As such, high quality partnerships mobilise UK and Irish health workers to develop the capacity of health workers in Africa through skills transfer, training, mentoring, and other collaborative work. The primary focus of partnerships then is on capacity building and staff development through targeted training. While they may provide additional support such as equipment and books, this is not their primary remit. The funding will support projects designed to improve the standards of clinical training at all educational levels, the technical skills of staff, or the efficiency and capacity within healthcare systems. The Africa Grants Programme was set up by FET and Johnson & Johnson in 2015, and so far there have been 3 rounds of the AGP, all varying slightly in aim.
What does this round look like? So projects under this round of the AGP will last between 6 and 15 months. They should all start from the 1st of May 2020. Although this is a bit flexible, so if you did want to start a bit later and have a slightly shorter project, that's fine. But the key thing is that they needed to have ended by the 31st of July 2021. Grants are available from £30,000 to £75,000, and the projects themselves must operate within one of the specified countries in Africa. So this year it's Ethiopia, Ghana, Kenya, Malawi, Nigeria, Tanzania, Uganda, and Zambia. So the call opened on the 3rd of December of this year, and we're accepting applications up until midnight on the 23rd of February 2020. So those wishing to apply must submit their application form along with a budget. If you have a look on our website, all of those templates are on there by the 23rd of February. So this year's round of the AGP differs slightly from past rounds in that there's no longer going to be a community health stream, And instead, the focus of all grants will be targeting essential surgery and anaesthesia to treat maternal, neonatal, and paediatric conditions. So the call's got two objectives, both relating to improving surgical and anaesthetic care for maternal, neonatal, and paediatric conditions. The first objective is to reduce morbidity and mortality for children and mothers from conditions requiring surgical intervention, and enhancing patient safety as a result of improved anaesthetic care through the training of relevant health workers. The second objective is to improve the access to and the availability of quality surgery and anaesthetic care for mothers and children. So your project may focus on one or both of these objectives, but if it is just focusing on one, we'd like to see how you've considered the impact on or from the other. So the cadres being targeted during your intervention should be ones who directly work within the surgical ecosystem. But this is excluding people like biomedical engineers who, although they do work, they will work to improve and maintain equipment within the theatres. They're not directly involved in actually carrying out the surgeries. So your intervention should target staff who are directly involved in carrying out surgery on mothers.
Eligibility. So, as with previous rounds of the AGP, there are several eligibility requirements. First of all, grant recipients must be eligible organisations under this programme. And you can refer to the Q&A document online for further information on this. But basically, applicants must consist of a UK/Irish partner and a partner from one of the target countries. The UK or Irish lead partner must be either a UK or Irish registered authority that is involved in health education or health delivery activities, or a recognised UK or Irish health delivery institution, health education institution, or professional association, including regulatory bodies. The lower middle income country partner must be a not-for-profit institution based in an eligible African country that is involved in health education or health delivery, or a recognised national health delivery institution, health education institution, or professional association. Any applications made by a single organisation will not be accepted. The next eligibility requirement is that projects must fit within the parameters of the call. Then project budgets cannot exceed £75,000. We'll go into further detail later during this webinar on what activities will and will not be funded. And projects must operate within one of the eligible countries, which have already been mentioned. And to qualify as an established partnership, the lead partners must have collaborated on a project or scoping study for a minimum of 6 months, including face-to-face meetings. And applications we receive must be submitted in English. So, as I mentioned earlier, or as he mentioned earlier, there are 8 countries which are eligible under this call: Ethiopia, Ghana, Kenya, Malawi, Nigeria, Tanzania, Uganda, and Zambia. All projects under this programme should be operating in one of these countries. So in terms of project and partnership criteria, the project needs to be single, coherent and time-bound, and deliverable within the budget and timeline proposed and agreed with SET. Though this project might be a continuation of previous projects, we want to see that the impact of this can be measured within the time frame of your project. So next is that the project needs to contribute to the overall purpose of the Africa Grants Programme. The project needs to be aligned with overseas country policies and plans. The approach of the project needs to be appropriate and relevant to the local context, and the project needs to be based on recognised good practice. But then we'd also like you to consider throughout your application and when you're putting together your proposal, how your partnership adheres to the principles of partnership. And these are 8 pillars designed by SET, which are used as benchmarks to establish the strength and quality of a partnership, and therefore how you're able to implement your project. Further details of these can be found through our website and the call document, so we encourage you to have a look through that and keep those in mind throughout. So further project and partnership criteria, the project needs to consider how it will benefit women, children and underserved communities. So we'd like applicants to identify what barriers there are to these groups from accessing services, and how the project will overcome them. In addition, applicants could consider how they'll encourage more women into training and support them to take on more of a leadership role within their institution. So the project aims also need to be clear and logical with a focus on measurable outcomes. Once the grants have been awarded, we'll have inception meetings, part of which will focus on monitoring and evaluation. It's always a good idea to think about what outcomes you want to see from your project and how the inputs, for example, the people you train, feed into these. Theory of change diagrams, for example, an excellent way of mapping the journey of your project. Then next is that the project needs to demonstrate value for money. And so one of the key aspects of the project that can be used to demonstrate this is the use of volunteers. Perhaps think about how you can demonstrate value for money in other ways as well, such as by communicating via Skype or online rather than traveling the country. Next is that the partnership has the capacity to deliver the project, demonstrated through past successes, and then also that the project effectively engages short and or long-term volunteers in order to deliver project activities. And then finally, for this slide, the project impact needs to be sustained once the life cycle of the project has come to an end. So we're very keen that when planning your project, you think about the implications for sustainability. So if you're buying equipment, for example, is there the expertise, spare parts available in the relevant institution to fix it if it breaks? Or another example, have you been able to buy-in from senior management or the Ministry of Health that they will continue to support the outcomes of the project once fundings come to an end? These requirements that I've mentioned in the slides, and the previous slide, form selection criteria for the project and the partnership. Applications will be systematically assessed against these, so always try to keep them in mind as you are filling in your application form. You're strongly advised to refer closely to the Q&A document available online for more detailed explanation of each of these points. And you can also keep the list in front of you and use it as a checklist to ensure you've covered each of the points in the form. Some of the criteria will be explicitly linked to specific sections of the form, and for others, there won't be a designated section, but we expect you to demonstrate how you meet these criteria throughout or across different sections of the application. Please don't assume that we know your partnership or the project you have delivered in the past. And it's always a good idea to ask a friend or somebody who's non-technical to read through the application for spelling, grammar mistakes, for sense and flow, and see how well you've responded to the requirements put out. And we advise you to fill in the application form for the budget template in order to avoid missing out any key costs. So next, we're just going to have a look at the application form you'll need to fill in. Just bear with us 1 second.
Right. Okay, so now I'm going to briefly run through the application form. I'm just going to highlight some particular areas, so I won't cover every section, as most of them are, well, many of them are self-explanatory and some of them are covered in the FAQ document. But in general, throughout your application form, it's a good idea to avoid using acronyms and technical terms, and try and make your application as readable as possible. So if we keep coming across acronyms that we don't know, we're not going to spend time Googling them and researching them. They need to be made clear right from the outset. And then please do respect any word limits which we provide as well. Right, so number one, summary details. So there is a section in here around your project budget total. We would, as Will mentioned, always advise you to fill this in after doing your budget. And then just be aware of the minimum and the maximum amount. So the maximum amount that we will fund is £75,000, and you're perfectly welcome to apply for this amount. But do bear in mind that that might alter the amount depending on the number and size of successful applications that we have. And this will be done once the applications have been awarded. There will be a period of time for negotiation around what the project budget is going to be in total. Right, section 2 is around the partnership. So we've asked you to provide the details of both the lead partner and the project coordinator. So this might be because the lead partner who will be responsible for signing any contracts, so for example, the dean of a school, might be a different person from the person responsible for the day-to-day activities and project planning. So please do make sure that you include the contact details for both parties. In section 2.3, There is a space for you to tell us about any other partners who will have an input into your project or who you've worked with to develop it. So this might include NGOs working on the ground, governmental departments such as the Ministry of Health, or technical groups. So it's a good idea to try and include as many of those in there who have worked on your project with you or who will in the future. Now, section 2.4 is your chance to tell us about your partnership. So always assume that we don't know about the partnership, even if we've received funding, even if you've received funding from us in the past. What's the history of how the partnership came about? How was it originally set up? How did you establish the need to have this partnership? And what have you achieved so far? So this is the section where you really need to sell your partnership. You could talk about the number of years you've been working together, what you've done together. You can describe grants that your partnerships received and tell us how much and what you've done with it. So try and be as specific here as you can, especially if you can give evidence of how successful previous projects have. That's something that we really look for. Section 3 is justification. So section 3.1 is the approach that you used for your needs assessment. Here we'll be looking to assess whether your research and methodology is appropriate and relevant to the context in order to come up with clear, well-evidenced needs. Section 3.2 is where you should describe the findings from your needs assessment. So what is the issue you're trying to seek to address? Try and make sure that you address the 3 points here, because these are part of the assessment criteria. Have you addressed the institutional as well as the national need? There are more details on this in the FAQ document as well, so do have a look there. And then section 3.3 is the opportunity which you have to really tell us what you're planning to do and why you think it's appropriate and necessary, given the context and needs which you've discovered. So in the next section, in section 4, you've got more chance to talk about the specific details of the activities, but in section 3.3, we want a broad overview of what you're planning to do and what you hope to achieve. So section 4.1, please list all of the activities which you're planning to do as part of your project. The more specific you are, the more of an idea we'll be able to gain about what your project entails. Do obviously add more lines if necessary, and be aware that we might come back to you with questions about the specific activities as well during the application assessment phase. Now, section 4.2. So those of you who have completed applications for the Africa Grants Programme or the Health Partnership Scheme funding before will see that we're not asking you to complete a full project plan with indicators and targets anymore at this stage. So we are, however, asking you to describe the changes that you expect to see as a result of your project and in relation to your overall goal. So it's a good idea if you can tie these in with the overall goal of the AGP and this round of funding. So you'll find some examples of what this might look like in the FAQ document, but do expect to complete more detailed project plans later on if you're awarded a grant. We will work with partners to develop more comprehensive monitoring and evaluation plans. So though we haven't asked for a full MEL or project plan, in section 4.3, we would like you to describe the kind of MEL systems that you have in place and the type of data which you'll be trying to gather and how you'll go about doing that. So as Will mentioned, we are particularly keen on thinking about the sustainability of projects. So you should pay particular attention to thinking about how you're going to measure sustainable change, such as behaviour change of the health workers which you're training through your project. So at the moment, we work with an organisation called the Change Exchange, who specifically look at behaviour change among health workers. So it might be worth having a quick look at their website and seeing what kind of things that they do. So section 4.4, this might be a fairly tricky section for you to complete at this stage, given that you won't necessarily know the number of health workers that you're targeting or the number of patients that you think will access the service. All we want from this section is to kind of understand a bit about the scope of your project. So how many people, how big is the area which you're trying to reach? What kind of health institutions are you trying to target? That kind of thing. So don't spend too much time getting specific numbers. It's just good for us to know the scope of your project. Now moving down to section 4.8. Again, as Will said, we're particularly focused on ensuring sustainable change. So do use this section to explain how you've thought about this and what your plans are for ensuring sustainable outcomes. Now, section 5, around partnership management and support. So when completing this section, you should pay close attention to the partnership and the project criteria, because they break down what we expect out of the partnership. So section 5.1, the information that you provide here will help us to assess your partnership's capacity to deliver the project. So please note that if your project is shortlisted, we will ask you to provide documents to support what you've written in this section. So things like memorandum of understanding, letters of support agreement, and we will ask you questions as well about the functioning of the partnership. So there's more guidance in the FAQ document around what kind of things we're looking for under each of these categories. So do have a read of that as well. And then, as Will mentioned earlier, section 5.2, we'd like you to think about the principles of partnership when you're filling out this section. So the section is designed for partners to outline how they as an institution will benefit from the project. We expect partnerships in their project to be mutually beneficial, to promote learning and respect among others, and we expect each partner will work together according to their expertise and capacity to deliver the project to the best of their abilities.
For this round of African program funding doesn't differ significantly from previous years. So if you applied for this round before, grants came before, you'll be familiar with it. It has been updated very slightly so that applicants and reviewers have better visibility of budget allocation per category, where the budget limitations are affected and where each of the costs sit within that program. Some of the cells within the spreadsheet are locked, but these cells contain formulas which automatically populate the cells being completed. When completing your application, we do recommend that you complete the narrative part where you can set out your changes and activities before submitting the budget. Once you establish your changes and the activities you will be undertaking to achieve those changes, you can consider the related costs. So these activities should relate to your project. So your activity plan is section 4.3 of the application form. So it might be a good idea to broadly define each of the activities, i.e. trainer, rather than break down individually into numerous activities, i.e. etc. So the categories, so the rest of the categories are standard travel, equipment, and project management costs, which you'll be familiar with if you've applied for funding from SET in the past. You will need to populate column C with cost per unit, column E with the number of units, and provide any relevant details in column K. As per previous funding calls, project management and equipment and refurbishment costs should not exceed 20% of the overall budget effectively. And we would expect monitoring and evaluation to make up 5 to 20% of your overall budget, including research and dissemination. You can track overall percentages in the budget category summary section in the bottom of the template to ensure that you don't exceed limits for any of the categories. So in terms of what we won't fund through this programme, we won't fund entertainment costs, which are costs associated with entertaining individuals and/or groups of people, usually involving eating, drinking, and other hospitality. We won't fund costs relating to the delivery of health services outside of the scope of the project. And we won't fund capital costs, so costs which cover the building or construction of new facilities or infrastructure. And we also won't fund per diems. So while travel and food costs can be refunded to training participants, SET does not support per diems being paid to training participants solely for attending the training. So just a couple of other things to consider when thinking about what you're going to put into your budget. So staff costs for project management, we do encourage you to think about putting some money into your budget for this, as in general projects with a paid project management do run more smoothly. Obviously, this still needs to fit within the 20% of your budget, which can be allocated for project management, but you can also spread this cost around monitoring and evaluation if they also help with data collection, analysis and report writing. And if you're planning on publishing your findings or carrying out any research, you probably need to think about getting ethical approval and the costs and time associated with this. Yes.
Right, so I'm just going to finish shortly with an overview of the application process. Because we are finishing soon, do think about if you have any questions and start typing them into the chat box or the Q&A box at the top. So finally, just a quick sum up of the application process and the timeline which we're hoping to work with. So as you know, the call for applications opened on the 3rd of December. If you wish to apply, partners will need to submit a completed application form and budget to agp@thet.org by midnight on the 23rd of February. So once you've submitted your application, you should receive a confirmation of receipt within 48 hours. If you haven't received this, then do resubmit your application with proof of your original submission if the deadline's already passed, and we will get onto that. So then staff at THET will do a preliminary shortlisting of the applications based on eligibility and against the project and partnership criteria. And then this will be followed by an external selection committee. So it'll be consisting of professionals working in the target field along with some THET staff. And then we'll meet to decide on the final outcomes of the call, hoping to inform applicants of the outcomes by the 1st of April 2020. So in some instances, funding might be awarded conditionally, dependent on the outcome of inception meetings or clarifications, and then agreement of the final amount of funding awarded. So then throughout April, THET will carry out inception meetings with the successful applicants in order to develop and finalise monitoring and evaluation strategies and project plans, as well as conduct the contracting process, with the view that projects will start from the 1st of May 2020. Right, so I'd now like to open up the floor to questions from our audience. So perhaps if people have questions, they can type them into the question box, and then we can read them out and then Will and I can respond to them. Right, we'll just wait a minute or two to see if we get any in. Any questions for anyone? I mean, if you'd like to ask them yourself, I'm also available to, I can unmute you, so you can ask them yourselves.
Perhaps just while we wait for anyone to write a question, I can ask the question that we often get given. So maybe what we mean by a partnership.
Yeah, so by this we mean a partnership who has worked together for around 6 months. So when we say work together, we mean they might have carried out a needs assessment together or done a scoping assessment to determine the need in that health institution. We would prefer that partners have actually met each other face to face rather than it just be an email or Skype exchange, although obviously that's not always necessarily possible, so Skype is fine. Essentially, yeah, that's it. They don't need to have carried out a specific project together. It's just having worked together for around 6 months.
I'll ask one other question. I think I can anticipate perhaps other people asking throughout the time people have to fill in proposals. So perhaps a partnership is carrying out general surgery that women who are mothers could undergo. Does that fill the criteria of this call?
I would respond to this that Johnson & Johnson would like projects specifically targeting maternal or pediatric conditions. So if, say, it was just some general surgery carried out on a woman of childbearing age, that wouldn't be eligible for this call. It needs to be specifically maternal or pediatric conditions that are being treated. Okay, so we've had a question from Elite's book. If one's institution has not had a partnership project with the UK counterpart in the past 6 months, can one still apply? Now, it depends whether the partnership existed prior to the 6 months. So it's fine if you haven't worked together in the past 6 months, but if you've worked together for more than 6 months prior to that period of time, then that's fine. Do you have anything to add, Will, to that?
No, I wouldn't have anything.
Yeah, perhaps, Elite, but if you could let us know what you mean by that, whether they've worked together previously, just not in the last 6 months, or whether they've never worked together. Okay, thank you. Does anybody else have any questions? Okay, it doesn't look like it, but if anyone does have questions that they think about afterwards, you're welcome to email us on agp@thet.org, or mine and Will's email addresses are both on the website as well if you'd like to get in touch with us. Okay, sorry, we've just had a question from Olubunwin Lawal. Will grant covers travels for baseline or needs assessment phase? So yes, if the needs assessment is within the project itself, then yes, we will cover those costs. But I would think about the strongest applications are ones who are already aware of the needs and have framed their project proposal based on a pre-existing needs assessment. So while we will fund needs assessments, it might be that the project is not quite aware of what its target is going to be if they haven't already carried out a needs assessment. Okay, we have a question from Alison. If there was an opportunity to screen mothers in postnatal review for cervical cancer that would lead to early stage cancer treatment, would this be feasible? Now, unfortunately, I don't think that would be applicable because it's not something which is happening within the surgical ecosystem itself. It's more of a pre-surgical screening rather than a surgical intervention. So unfortunately, I don't think that's something which Johnson & Johnson would accept under this application call.
And in terms of your other question, Elite Book, about how you can access this recording later, it will be uploaded to YouTube. So that's how, and we can share that through social media, the link.
James has asked whether there's flexibility in starting date. So yes, there is flexibility in starting date. The only deadline that has to be met is that all grants must have finished by the 31st of July 2021, and that the projects need to be at least 6 months long. So there is a lot of flexibility in the starting date for that. Right, that looks like it's all our questions. Oh. Our project's geared towards post-operative recovery and rehabilitation to improve quality of life through patient and health workers training eligible for application. Now, unfortunately, again, quite similar to Alison's question, post-operative care is unfortunately not part of this call as well. Johnson & Johnson are very keen to focus on the surgery itself rather than screening or post-operative care. So unfortunately, that wouldn't be eligible under this call. Okay, I think that's everything. But again, as I was saying, if anybody does think of any more questions, do feel free either to email us through the AGP inbox or give the office a call, and one of us will speak to you then as well. We're aiming to get this webinar up online in the next day or so, so do have a look. Oh. Sorry, one last question. Will a project based on perioperative decision making, which relates to deciding whether a child has immediate or delayed surgery, be eligible? Now, that's something which I will need to go away and have a think about, because I'm not sure whether any kind of triage decision making will fall under this. Let me get back to you. And sorry, the person who's asked that question, I wonder whether you could just drop the AGP inbox an email about it, and I'll respond to you through that, and then include the answer to that in the FAQ document as well. Great, thank you. Thanks very much. Yeah, I'll have a think about that one. I might have to go back to Johnson & Johnson and see if they're happy to fund perioperative decision making. Right, thank you everybody. Again, do get in touch if anyone has any further questions. Thank you.
Thank you. Bye.